I'm Dr. Anthony Cave, and I'm here today to share what you need to know about childish behavior that can happen in operating rooms like this one, so that you can hopefully get the care that you deserve and recognize that intimidation in particular is not just unique to elementary school kids, but happens even here in these really expensive, fancy, and state-of-the-art operating rooms. And if you're wondering how on earth people can be childish and maybe why does it matter if you're the patient, look no further than the tragic case of Bill, whose surgeon removed the wrong organ. Instead of taking this, taking this organ out, the liver, instead of the spleen. Sorry, that's kind of a nasty looking spleen there. But the spleen, which is on the opposite side of the body. How could a surgeon take out the wrong organ? And what happens if the wrong organ, like the liver, comes out? And how could speaking up and maybe facing that type of intimidation in the operating room have potentially prevented this? Debbie, I'm good to see you on here. And Zarga, I appreciate it. This is an incredibly bizarre case. And if you didn't want to look it up, it's okay, because we're going to talk about it right now. You might think that all doctors and nurses and technicians in the operating room all get along very well, all thumbs up. That's not true for many reasons. And if you appreciate why, especially if you're in the healthcare field, I hope that you can better advocate for your patients. And if you're a patient, you can better advocate for yourself. First off, needless to say, are the letters after your name. So I'm grateful that I have some fancy letters after my name, spend a lot of time and a lot of money getting them, but they mean that I certainly have a level of expertise that others might not have. That's okay. Doesn't mean that I should ignore or blow off what other people say. Sadly, I don't think that this memo reached the rest of the world. I'm not saying I'm better than anyone else, but I'm saying that having a sense of humility, maybe because of my age, maybe still being in the first 15 years of practice versus someone who's 35 years in practice, doesn't matter so much as recognizing what the end outcome is if people are unwilling to listen to what's going on. Because you'll see in this case that touching the liver and messing with the liver could not have gone unnoticed by others in the room. And hopefully you would think if people had spoken up early enough, might have prevented the lethal outcome from this. And yes, Kathy, about the anatomy class being taken, I agree. And OMG, Juliet, I absolutely agree as well. Another issue is seniority. Needless to say, old people tend to get more respect and maybe more authority, may or may not be deserved. This is both in Western medicine and in the Eastern world, all over the world, quite frankly. Does not allow for a flat architecture, needless to say. By the way, this picture that I pulled up here, look at how many like ribbons and all that this old guy's got on him. Nothing against being old. Nothing against having accolades and having letters after your name and having gone to great schools like I have. I'm really, really blessed and grateful to have had that opportunity. But to not have humility is problematic. You can also have doctors and nurses and technicians who have a bad day. But the issue is that if those get in the way of good patient care, it can lead to these kinds of outcomes. And I personally will share stories from myself when I was a younger doctor, like this baby doctor you see here. I thought this was a hilarious photo. The number of people that intimidated me in the operating room, I'm going to be flat out honest with you. Because if I get intimidated as a white man in the operating room, having gone to all the big name schools with the letters after my name, you tell me, how about patients who get intimidated, or nurses that get intimidated, or scrub technicians that get intimidated? I mean, you tell me, like, this is just the tip of the iceberg, what I'm going through. I'm not saying any of this is okay. I'm saying that certainly not for anyone, but more importantly, if you see something and the intimidation is getting in the way, you need to ask yourself, by not listening to my instincts, whether I'm a nurse, a tech, or whatever, something is likely going wrong. I'm going to ask you guys right now, if you have ever had an instinct, independent of what level of the hierarchy, what level of the age you are, right? All those rankings, what letters after your name, you had an instinct, you didn't listen to it, and something bad happened. Classic question, right? Tell me in the comments. I'm going to shout out who here has had that happen, ignored an instinct, and have something bad happen. I'm going to raise my hand. It's happened so many times I can't even count. And I still sometimes feel intimidated by people who should not be intimidating me. I know I'm not the only one. I'm looking closely here. I'm going to give a shout out to Mara. Thank you for being a member. I appreciate it. Linda says yes. Good to see you, Linda. G. Chris says yes. The Emo Surf says, I often feel intimidated by doctors of all ages. Symptoms ignored. Mary, absolutely. Melissa's raising her hand. Okay, so I know there's hundreds of you out there. And I see one person saying it is not. Oh, I have had it happen. Okay, Suzanne. Okay, so no one here is speaking otherwise. So why is it that we don't trust our instincts? Well, for the young doctor or the patient or whatever, it's easy. But I have had nurses stare me down and make me feel like a complete dum-dum. I have had scrub techs say ridiculous things about me. I've had other doctors, anesthesiologists, and surgeons throw me under the bus, trying to leverage money, trying to leverage status, trying to leverage reputation, stare me in the eye and gaslight me and BS me in a way to get me to do something they wanted me to do for them. So this expands beyond, I mean, I can give you specifics if you want. We can have a whole Q&A on what some of those scenarios look like. But suffice to say that having gone through the ringer multiple times as a young doctor, I'm at a point now where I hope you can also reach there. We call out BS in a way that is obviously respectful, in a way that's doing right by someone. Like with the comment that this surgeon said, the spleen was maybe 4 times bigger than it was supposed to be, and that's why I took it out. I wasn't there. I'm not involved in the investigation of this case. But having seen enough spleens, having seen enough livers, this strikes me as something concerning. If I'm the anesthesiologist in the room and the signs of a liver coming out instead of a spleen coming out are apparent on the monitors behind me, it's my duty to the patient and to the rest of the teammates and the hospital, etc., to speak up. Trusting my instincts, which I hope anyone in medicine, no matter where you are in the totem pole of age, of rank, of letters, having a bad day or good day, you're there. So to be very clear, taking a spleen out, just so you know what this could even look like in the operating room, spleens come out for a couple of reasons. Electively, they usually come out for blood disorders, maybe cancer, maybe immune-mediated conditions. It's not super common. It happens in trauma if a spleen is damaged and is bleeding, because a lot of blood goes through the spleen. Those are not elective cases, but there are times when spleens should come out. There are times when livers come out electively. The most common cause is if there is metastases of colorectal cancer, because they preferentially can flow to the liver, and those are times of elective hepatic or liver resection. This is what a liver looks like when it's cirrhotic. It's got that bumpy nodular surface. A couple of important things to recognize here is that 1, that does not look like a spleen. 2, that's on a different side of the body. 3, it is much bigger than a spleen. Your liver is 2% of your body weight. Number 4, the vasculature, meaning the blood vessels that go to the liver, are completely different than what go to the spleen. And this is very important because what happens in the operating room when a liver gets poked at the wrong way, or sometimes even the right way, but for reasons we can't control, this big mass, 2% of your body weight, gets very bloody very fast. This is how Bill, I strongly suspect, passed away on the operating room table at his most helpless, vulnerable state possible. And yes, Heather, I agree. A whopping WTF. And hey, Linda, thank you for the kind comments here, but it's just beyond me how this could happen. I hope that you speaking out, if you see something wrong, listening to your instincts, which get buried after betrayals of trust, after traumas, etc., you can hopefully help better advocate for yourself and those around you. Blossom, if you've been trying to ask a question, I didn't see it, I'm apologizing here, but if you want to ask questions, please, if you join the membership, I can far more easily see your comments so I can answer them. But back to the liver. The liver is also, I don't know if you guys know this, but the liver has a remarkable capacity to do what Wolverine does. If you know this, let me know in the comments. So this is Hugh Jackman. I've not seen the Deadpool movie yet. I really want to, but Wolverine, as you know, has this mutant superpower where he can regenerate. The liver can also regenerate. If you're left with as little as 20 to 30% of liver, your body will fully regenerate your whole liver within about 6 months. So you might think, oh, well, the liver can fix itself. Why is this a problem? Why is cutting out part of the liver a problem? The problem is because it is such a bloody organ. There's so much blood going to it from the hepatic artery and from the portal vein, gives it about 20% of all the blood your heart pumps, 20% goes to your liver. And if you are resecting your liver, you need highly specialized surgical tools and anesthesia techniques to keep that person alive. The mortality from hepatic resections in the 1970s was like double-digit percentages. Something I wrote it down somewhere. It's my old school notes, by the way. But something like a mortality of 20%. 1 in 5 patients dying. And to be clear, morbidity is still very high after resections. But mortality is now in the 2% range. Mara, thank you for being a member, by the way. Liver lobes are donated because of this remarkable property, or at least they can try to be donated, but you can regenerate so much of your liver, unlike other organs that don't have that Wolverine-like regenerative capacity. I'm going to go back to that photo because I think it's a hilarious photo of Hugh Jackman. I will comment here, Bud, Rob, you're right. You need to have healthy liver. Cirrhotic liver will not regenerate nearly as well. So you are correct on that. So we are talking about healthy liver regenerating, but still requiring specialized surgery, one that involves central lines so that you have access, like what you see here, to deliver large volumes of fluid if they're lost. A surgery technique that has arterial lines, like the wrist arterial line and the radial artery that you see here as well, so that we can constantly monitor fluctuations in blood pressure to estimate volume loss, to replenish blood or volume if needed. This is not what happens in a spleen removal, which is what poor Bill was going into surgery for. My point is that if perhaps the anesthesiologist saw, and I'm not blaming him, I was not there, I cannot comment, but to say that we can minimize the chances if anesthesiologists speak up when they see things that are looking wrong on the life support monitors. If nurses are seeing something wrong, if scrub technicians, guys, there's an army of people in the operating room. It costs, in some studies, between $50 to $100 a minute of operating room time because you have to pay so many individuals to be here for surgery. If they can all be looking out for the patient, and if they feel comfortable speaking up, to trust their instincts, I posit that this could potentially be less common, these disastrous consequences. Let me know what you think below. I'm very curious as we jump into our live Q&A here in a second. But I want to end by saying that this is what spleen looks like under a microscope. This is what liver looks like. You should not have to wait till you've resected it and looked under the microscope to see which one it is, right? Liver, by the way, all those little purple things are white blood cells because a lot of white blood cells filter through the spleen. And these white canals that you see are the sinusoids of the liver. We should be able to trust our instincts and prevent having to figure out what was removed from a body under the microscope while the patient's still alive, to get in front of a tragedy happening. If you agree with that, please speak up for yourself and share this with your loved ones. Remember that you have more power over your health than you've probably ever been told, but it might be difficult, maybe impossible to access that unless we are trusting our instincts. So with that said, I want to jump into our live Q&A. So many questions coming in, and starting with Bumblebee. Yeah, a lot of bullying and power ego preventing people from speaking up. That's what happens in the operating room so commonly, especially in institutions where there's a very strong hierarchy. I'm grateful I don't really work in one like that anymore, but I have been through plenty of operating rooms like this, and I've seen plenty of things that should not have happened happen. Hey, Arkem, you're so welcome. Thank you so much for that comment. Hey, if you guys are learning something new, you can join our membership on YouTube so that I can more easily see your comments and answer them. And you support me to do this more often for you. I appreciate all of you new members that signed up yesterday. I actually have a list that in my Luddite form, I forgot to put in the slides. So I'm going to give a shout out to Gregory, Lisa, Heidi, Peter Princess, and Mara, and Cat Keeps on Cat, and Redondo Beach. Thank you so much for supporting. It means a ton to me and helps other people also learn from your questions. So speaking of Mara, I always ask for a huddle of all the people in the OR before they take me back. A huddle is when all the different team members get together to review the importance of the case. What side, what allergies, what organ, any complications that are anticipated, the appropriate preparations, etc., etc. You deserve to have a huddle. And if you have any concerns as a patient, that's the time to speak up. And if you're a member, like a nurse, etc., that's the time to speak up as well. Can cirrhosis of the liver regenerate? Maria, typically no. That's the problem with cirrhosis. Once the liver, by the way, there's only one type of cirrhosis. It always refers to the liver. There's not like cirrhosis of other organs. So you can just say cirrhosis, and that implicitly means liver. The problem is that it doesn't really regenerate, and that's why it can be so lethal. And hey, Jerry, I'm so happy to see you on a live finally. Alicia, in the abdomen, I named her not following. Is this a riddle? I don't understand. Emosurf. It's crazy how much seniority and ego can fuel poor treatment of others. Agreed. I'm sure others have seen this as well. You're so welcome, CSI. Melissa had surgery last year. They paused once they got in there. Put up things on the screen, and I was going to have done, and they made you confirm. And Melissa, did you feel more comfortable with that? Did you feel more safe going under anesthesia? Because when you're going to sleep on the table here, the more comfortable and trusting you are of the situation, of the team, of your doctors, the more comfortable patients tend to wake up with fewer complications. People should stop treating doctors and dentists like God. Well, certainly they're not God. Treating them with respect, the way that doctors should treat patients with respect, is the safest, I believe, the most professional route. Tips for kidney disease, Rugel, that's a tough one. Not right now. It's a whole different topic there. I'm happy to talk about that on a future live stream. Well, question, Steal the Catwalk. Can iron infusions in a nutritionally depleted and severe immune dysfunction cause infiltration? Well, that's kind of some niche medical advice, which I can't give over YouTube here. Sorry about that. I hope that you have a doctor providing and prescribing the iron infusions. Speaking of doctors, I would never trust a doctor. Well, acetyl, that's also not the point of this, because there are doctors that are trained and experts in how to help heal the body. Not trusting them might be throwing out the baby with the bathwater kind of thing. And I hope that if you have been hurt in the past, like I know many people in the world have been, that we don't use that. That does not become a trajectory to us not getting the care that we deserve. Toyotas are us. So anesthesiologists, like any other human being, there are some bad apples out there. But if you had one who was rude and mean and scared you, I hope that you spoke up to help prevent that from happening to someone else. I'm sorry that you had that experience. Narcissism has been a characteristic of every doctor I've known. I'm sorry, Beth. I certainly hope that this is changing your opinion. How do you not anger a doctor by asking for a second opinion? James, I have a couple videos on ways to non-confrontationally discuss your care with doctors to get the care that you deserve. The easiest way is to be very clear about the plan and ask them what the plan is, because doctors get paid for assessments and plans, and you deserve to have clarity on what to expect in the coming days, weeks, or months based off of how your conversation goes with your doctor. I hope that helps as a start. Shadow Mind, good to see you on here. I don't want colchicine nor indomethacin, same drug, as they aggravate my other problems and risk CHF. Well, I certainly hope that if you have gout and that's why you're prescribed them, that other lifestyle interventions have been discussed to potentially reduce the need for those medications. Education does not equal competence, Steal the Catwalk. This is true. I don't want to be aggressive or, there's a lot of capital comments coming in here, all caps, a lot of angry people. This is not meant to be and there's another example here of from Thomas. I don't understand why doctors won't do multiple surgeries at the same time. Guys, I want to make sure that we advocate for patients and we advocate for doctors who are doing the right thing. This is not meant to be an avenue to vent on doctors, because the vast majority of doctors are probably doing their very best. And I'm grateful that you clarified there. Still the catwalk. Thank you. Doctors cannot do, to answer your question, Thomas, multiple surgeries at the same time because of certain medical limitations sometimes. That being said, sometimes insurance companies also get in the way. So it would be naive to say that it's only for medical reasons or only for insurance reasons. But unfortunately, it doesn't always give patients the care that they deserve. Linda, thank you for becoming a member. Very good to see you on here. I'm happy that you figured out how to do it. Azar, the surgeon operated on the wrong organ previously and settled in court, and that's also problematic, I must say. Thank you, Amara, for welcoming Linda. Julia, you are so welcome. And Melissa, I'm happy that you've also had good experiences with doctors as well, seemingly. I am sorry, Bubble Tea, that you failed 5 referrals so far for your MECFS. I have a couple videos on that. I encourage you to check those out. Maybe there's something new that you can learn there as well. You're very welcome, Linda. James, I'm thrilled to hear that you have been able to ask those questions of your oncology team. Florida is trying to keep people from moving there. Well, that's a politically driven issue sometimes, isn't it? Well, we can say the same about other states as well, but I hope that this is not a reflection of other doctors in Florida. I'm sure it's not. Mark your patient's surgical site in place. Faith Robin Buchan. Yeah, this is one of the cheapest and fastest and easiest high yield things to do to help prevent surgical errors. Please, please, please mark your patients. I even try to do the same thing for anesthesia when I'm doing a procedure. For example, a nerve block, I should also be marking as well. You're so welcome, Baby Bumblebee. JP Stone, good to see you. Hey, better late than never, Kat. Good to see you. Jerry says, generally, my doctors have been caring, conscientious, professional people. There's been a rare exception. I'm sorry about the rare exceptions, but I'm grateful that overall, your experiences have been positive. Linda says, I'm having an EGD tomorrow. That's an esophago-gastroduodenoscopy. So it's a camera going down your mouth into your esophagus, into your stomach. I plan to do a walkthrough and talk to the anesthesia doc and the charge nurse. They said yes, and they said yes, and they blew you off. Well, I'm sorry that they blew you off, but Linda, I certainly hope that you can schedule this before the day of, because on the day of procedures and the day of surgery, things are often moving too fast to allow for that level of, and I'm not saying it's okay, but it might not be something that the system can handle. To get the extra TLC on the day of, hopefully it can, but it will be far more likely for you to get that type of exposure therapy, if nothing else, by going in before the day of. Things go slowly before surgery, they get really fast on the day of, and that's when mistakes can happen. That's when blowing off and gaslighting can happen. It should be the other way around. We should be going fast in the waiting period and slow down on the day of surgery. That's not how human beings operate, unfortunately. Thank you, Joanne, for being a member. My surgeon helped me with my EDS diagnosis. I guess it was like trying to suture through butter. Wow. Sometimes it's like suturing has a problem, or sometimes the mobility of the tissue is problematic. I'm happy that you were able to get a diagnosis to help clarify what you've been experiencing. I hope that you found some level of healing and improvement having the diagnosis of EDS instead of it just being one of these nebulous conditions. Linda says you planned a week in advance and the charge nurse never called back. I'm sorry, Linda. I know you're not the only one who's had this issue happen. I'll end with this story, guys. As a doctor myself, I've tried calling other health institutions to talk to doctors. I have been blown off by so many receptionists, charge nurses, etc. You wouldn't even believe it. And the person who gets hurt in the long run is the patient, because those people that blow me off on the phone they're like, oh, thank you for calling. Please hold. they hang up on me, which happens all the time. They go home after the job, and they don't have to have like an organ removed or go home with horrible, intractable depression or thoughts of hurting themselves or others. And it breaks my heart that there are people that work in the system who really don't give a darn. My point is not to be pessimistic. There's so many people that care. But if you find yourself facing someone who really does not care, I just want you to feel this much more confident today after this discussion to hang up the phone with them and call again. Find another charge nurse, find another person who does care. Because there's this saying, as you know, the teacher shows up when the student is ready. I'm not exonerating any of their bad behaviors. I'm certainly not exonerating this bad doctor. I'm not blaming patients for being stuck in these situations. But I am saying that if you have the confidence to at least listen to your instincts, they're not always right, but if you don't listen to them, you're more often than not going to end up regretting it later. With that said, Patty, thank you for joining the membership. It's very, very nice to see you on here. And Jerry, thank you for that super thanks. You've all been wonderful. I hope that you all remember that you have more power over your health, and you can better tap into that if you have the confidence to listen to your instincts. Linda, I'm wishing you the best for your EGD. I hope everyone here is sending you positive vibes. And Hask, or HA5K, thank you for joining the membership as well. I hope to see you on the next live